All right, I am recording. Hi, folks. My name is Michael Hunt. Just to give you a quick bit of background on me, I was a state board certified physical therapist assistant for 14 years. I've worked in the healthcare field. I've worked in the healthcare field for about 14 years. My wife is a state board certified physical therapist, continues to work in this field and has done so for over 20 years. So together we have almost 40 years in the healthcare industry. I say that just to give you a little bit of background to let you know that I have some knowledge about what I'm talking about. But I'm not going to be talking about my opinions on things. I want to clarify some things and set some things straight regarding mask wearing in light of the whole COVID-19 ordeal. Excuse me. I am sitting on the deck of our condo. I'm on vacation at the moment in Branson, Missouri. So you may hear some planes fly by every once in a while. My kids may open the door and ask me a question or something. I don't know. But anyway, I will get on with what I'm going to talk about. There's been a lot of controversy about masks and mask wearing, and now a lot of states, I don't know if a lot is the right word, but several states are beginning to mandate mask wearing. I am against that, and I'll tell you why. I'm not against wearing masks. I currently work in a situation where I have to wear a mask at all times while I'm working. I don't have a problem with wearing a mask, especially since I worked in the healthcare field. I wore a mask often. I kept PPE, personal protective equipment, in my car at all times. I do not have a problem wearing masks where they are warranted, where they are needed. What I do have a problem with is being bullied or told that I have to wear a mask out in public, because masks do not do what you think they do. Okay, and I'm going to prove that here in just a moment. So let's go ahead and start. I'm going to share my screen here. Let me get this going. Some things out of the way. So first of all, I want to. I'm gonna spend a lot of time on this website right here. I might refer to one other website, but this is, as you can see, hopefully you can see this, the website for the Association of American Physicians and Surgeons. Okay, the Association of American Physicians and Surgeons. This is a very professional healthcare website. Okay, Association of American Physicians and Surgeons. And the curator of this website, which I assume what that means is the person who puts this website together, is Dr. Marilyn M. Singleton, as you can see right here. MD, JD. The JD means she has a Juris Doctor, which means she is a lawyer. The Juris Doctor is the highest law degree in the United States. So the person running this website is not only a physician, a medical doctor, but is also a lawyer. So you can bet your little bippy that the information on this website is true, is legal, is justifiable, or else she is putting her reputation on the line here. Okay, so the first thing and this is on this website, we're in the area about mask facts. All right, the first thing I want to point out, I'm going to highlight this right here. A COVID-19, SARS-CoV-2, SARS-CoV-2 is the disease that can cause COVID-19. A COVID-19 particle is 0.125 micrometers, or micrometers, however you want to pronounce it. For the sake of this video, I'm going to say micrometers. 0.125 micrometers. Very important to keep that size in mind. Goes on to talk about the flu. The influenza virus is much smaller, anywhere from 0.08 to 0.12, same size. And just to give you a little bit of context, a human hair is about 150 micrometers, not 150, 150 micrometers, the size of a hair. So now you have an idea at 0.125 micrometers, or microns, you could say that as well. That's the size of a COVID-19 particle. Okay? You're going to keep that in mind. Now, I'm not going to read everything, every little line on this website. You can find it. I'll leave. I mean, you can see the website here. I'll be posting this on Facebook too, because I've had so many people trying to argue with me about masks, and that's fine. Everybody has their own experiences, and I know everybody has looked at their own websites, and you can argue with me, and you can show data that contradicts everything I'm saying, whatever. If you want to wear a mask, great. If you don't want to wear a mask, great. Just don't be bullying each other to do what you think is right, okay? I am just pointing out from this website, the Associated American Physicians and Surgeons, curated by a doctor, a medical doctor, and a lawyer, what they say. Now, this website, the information on this page, there you see all these links. There were a lot of different studies. This whole section is studies from other places. Now, just because they're other studies and not studies done by the AAPS doesn't disqualify this. If anything, you've got all of these backing up what this is saying, okay? Proving their statistics, giving you they're not, I mean, it's not even an agenda on here. It's just showing you the facts and the results of tests, okay? So here it talks about droplets. Virus is transmitted through respiratory droplets produced when an infected person coughs, sneezes, or talks. Okay, just pointing that out there. So if you don't cough, sneeze, or talk and you're sick, chances are you probably won't spread it, especially if you're not coughing, sneezing, or talking directly into somebody's face. Okay? So if you can keep sick people from coughing, sneezing, or talking directly into your face, you're going to be okay. Your chances of not getting sick are pretty high. All right. Air currents, talking about air conditioning. You can read that later. I'll post the link to this website. You can check out everything. See if I'm right or wrong. See if I know what I'm talking about. I'll post that on Facebook as well. Person-to-person contact. And then talking about surface contact, just showing that it is possible. This is based on data from lab studies on COVID-19 and what we know about similar respiratory diseases. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. Okay, but this isn't thought to be the main way the virus spreads. So yes, you can get it by touching a surface that is infected with COVID-19 and then you touch your mouth, nose, or eyes. So if you do touch something, a doorknob, whatever that you think could be infected, or even if you don't think it could be infected, it's a good habit to just go wash your hands, soap and water, sanitize, try to touch your face as little as possible. Okay, pretty simple. Here's what I want to get to: filter efficiency and fit. This is data from the University of Illinois at Chicago Review. This is the other website. These are the two I'm going to be talking about most here. So this www.cidrap.umn.edu. It's the University of Minnesota. CIDRAP, Center for Infectious Disease Research and Policy. Okay. This is the study that they did. The ones who did this and presented this this study, Lisa M. Brosseau, I don't know how to pronounce the last name correctly. I apologize to Lisa if she happens to hear this or see this. And Margaret Sietsema, PhD. So Dr. Brosseau is a national expert on respiratory protection and infectious diseases and is a retired professor at University of Illinois at Chicago. Dr. Sietsema is also an expert on respiratory protection and is an assistant professor at the University of Illinois in Chicago. All right, we'll get to their conclusions in just a little bit. I've got it highlighted down here. We'll talk about that in just a moment. I'm going to go back to the AAPS, so Association of American Physicians and Surgeons. I'm going to repeat that a few times. Again, COVID-19 particle, 0.125 microns, micrometers. All right, let's get to filter efficiency and fit. Best filter, a HEPA filter. 99.97 to 100% efficient. Awesome filter. If you have an air filter at home, this is an excellent filter to have in your home because it will filter particles that are 0.125 microns. Same size as the COVID-19 particle. So there you go. Get you a HEPA air filter. You should be good to go. Excellent tool to have in your house. Masks and respirators work by collecting particles through several physical mechanisms, including diffusion of small particles and interception and impaction, that's large particles. All right. N95 filtering face piece respirators, the FFRs. N95 FFRs, the best ones out there. Without reading this whole thing, basically it filters through the process of electrostatic attraction. So it's like a magnet. Just draws them in. Not just catches stuff that happens to be flowing, it draws them in, okay, to filter them. Great mask. Now, your N95 mask. This is what everybody talks about. An N95. The number 95 means it blocks 95% of tiny air particles. A properly fitted is the key words. That's why they even have it emphasized there. Will block 95% of tiny air particles down to 0.3, down to 0.3 microns. How big is the COVID-19? 0.125. 0.125 is smaller than 0.3. It's a third smaller, or 2/3 smaller, actually. Okay? COVID-19 is 1/3 the size of the filtering, the 95% efficiency filtering of an N95 mask. Now, at 0.125, what's the percentage? I have no idea. Might just be 93%. Who knows? It might be 30%. I don't know. Nevertheless, N95 is a very good mask. Okay, so let me read this whole sentence. A properly fitted N95 will block 95% of tiny air particles down to 0.3 microns from reaching the wearer's face. Okay, so let's talk about this. From reaching the wearer's face. An N95 mask is designed to protect the wearer. Okay, it filters one way. It filters from the outside in. It does not filter from the inside out. It does not filter the exhalation. It only filters the inhalation. Okay? So, a sick person wearing an N95 mask, it will help them from getting sicker, I guess. But if the patient has COVID-19, not a good plan because it does not filter on the exhale. So the sick person is going to be breathing their infected breath out into the public, out into the air. So an N95 mask will not protect other people from what the wearer has. It protects the wearer from sick people. Okay? Just want to, hopefully that's understood. This goes on to say But even these have problems. Many have exhalation valves for easier breathing and less moisture inside the mask. So yes, some N95 masks have valves, adjustable valves on them. Some do not. Excuse me. So yes, they'll help you breathe easier, but they still don't filter the exhalation. Okay. A surgical mask, not the same thing as an N95. The surgical masks are those little blue masks that have the little metal tip on them that you can squeeze on the bridge of the nose to help secure the mask to the face. So surgical masks work opposite. They filter from the inside out. They're meant to filter from the inside out, not so much from the outside in. Will it prevent stuff from getting in? Yeah, it'll prevent dirt from getting in the mask, okay? But surgical masks are designed to protect patients from a surgeon's respiratory droplets. So that's why when you go have a medical procedure done, you have surgery, whatever, the doctors, the nurses, the surgical techs, they're the ones wearing the surgical mask. The patient doesn't wear the surgical mask unless that patient has to for whatever medical reason. But they're designed to protect the patient from the droplets, respiratory droplets of the surgeon or whoever's wearing the mask. Okay, so a lot of people out there I see on Facebook land are just bashing everybody else, telling them, wear your mask out in public. It's not to protect you. It's not about you. It's about everybody else. Wear your mask so you protect grandma. Not about you. Well, yeah, okay, there's some legitimacy to that. But watch this. Let's go back here. I'm going to highlight it. Surgical masks are designed to protect patients from a surgeon's respiratory droplets. These surgical masks are not effective at blocking particles smaller than 100 microns. That is not a typo. There's not supposed to be a decimal point right there in front of that one. That is 100 microns. How big is COVID-19 particle? 0.125, 0.125. Surgical masks are not effective at blocking particles smaller than 100 microns. How big was a hair? A hair was 125 microns. Surgical masks are designed to protect patients from a surgeon's respiratory droplets. They aren't effective at blocking particles smaller than 100 microns. For COVID-19, surgical masks do nothing. Let me repeat that. Surgical masks do nothing to prevent COVID-19. They cannot block the size of a particle of COVID-19. They cannot block COVID-19 particles. COVID-19 particles are 0.125 microns. Surgical, look right down here, surgical particles smaller than 100 microns. Surgical masks are not effective at blocking particles smaller than 100 microns. Surgical masks will not protect you from COVID-19. I did not say that. That is not my opinion. Are we getting this? That is not my opinion. This comes from studies done by respiratory experts. It's posted on the Association of American Physicians and Surgeons website, which is kind of freaked out there. It's posted on their website by a medical doctor who is also a lawyer. Now, you can argue all you want. Trash me all you want. I don't care. This is not my opinion, folks. I'm not spouting my opinion or anybody else's opinion. I'm giving you the facts. I'm giving you numbers from very reliable sources. Yeah, but the CDC says you're supposed to wear them. CDC says it's a good idea to wear a mask. Whatever. CDC can say whatever they want to say. I'm just giving you the numbers. You don't want to wear a mask, don't wear a mask. You want to wear a mask, wear a mask. I'm not telling you not to wear a mask. I'm not telling you to wear a mask. I'm telling you that for COVID-19, surgical masks will not protect you. They're not designed to filter lower than 100 microns. You can read it. I just showed it to you. Okay. This goes on to talk about some efficiencies of different things. I want to highlight this right here. All of the cloth masks, we're going to get into cloth masks here too. All of the cloth masks and materials had near zero efficiency at 0.3 microns. How big is COVID? 0.125. So it's safe to say that the cloth masks and materials had zero efficiency. At 0.3, that's a particle size that easily penetrates into the lung. So you can imagine COVID, 0.125, yeah, it gets in there. Yeah, COVID is real. Okay, folks, I had never, ever, ever said that COVID-19 was not real. It's not a hoax. COVID-19 is not a hoax, okay? It is a disease. It is a deadly disease, and I pray that nobody else gets it. Unfortunately, some people probably will. I might catch it. I don't know. I hope not. At the same time, I'm a pretty healthy guy. Healthy people tend to get over this. Okay, the death rates are going down. I'm not even going to get into all that. I've already been having those arguments. CDC reported that for the 11 straight weeks, the death rate of PIC has gone down. PIC stands for pneumonia, influenza, and COVID-19. So COVID-19 is a third of this grouping. It's part of this grouping, and the grouping, the death rates of the grouping of flu, of pneumonia, and of COVID combined, the death rates have gone down for 11 straight weeks. I know that the numbers coming into the CDC are lagging, but hey, I'll take every win I can get. That's awesome. I'm glad they're going down. We all want them to go down. I don't think anybody wants anybody to die or get sick, and they're going down. Yay! Let's celebrate that they're going down. Some of you don't want to celebrate anything. I'm not saying celebrate that there's this disease. I'm not saying celebrate that people are getting sick. Of course not. That's stupid. That's asinine. Okay? It's a real disease. It's a deadly disease. All I'm saying is the masks don't work like you think they do. All of the cloth masks and materials had near zero efficiency at 0.3 microns. COVID is at 0.125. Cloth masks will have nothing. Nothing. Will not help anything. I have to wear a cloth mask at work. I have said from the very beginning, this is the dumbest thing on the planet. The only thing it's good for is making other people feel safer. It's not gonna save anybody. It's not gonna help anybody. Not in the least bit. The cloth mask that I have to wear, yeah, might keep a dirt clod from getting in my mouth. Not gonna prevent dust. Oh, here's another thing. A week ago, I had a haircut. Went and got a haircut a week ago. At one point during the haircut, now and this cloth mask is a good, tight-fitting cloth mask. Goes over my nose, around my mouth. It sucks to my face. It's a good, secure. You can see me smile in this mask. You can see the outline of my lips. That's how well it is connected to my face. I was required to wear a mask when I went to get my haircut. The salon required that, so I wore my mask. At one point, to trim around my ears, I had to pull the little thing off my ear. A lot of you had the same thing. You pull the little strap off my ear, but I had to hold the mask on. So I even applied more pressure than what was already on there. So I pull it off my ear. I'm holding my mask on over my nose and my mouth, in case you couldn't hear me. I'm holding that on. As soon as she finishes over here, I put it right back around the strap. The mask never came off of my face, not even for a moment. Get finished the haircut, I leave the building, I take my mask off. Obviously, there's hair all over the front of my mask, but guess what? There's hair on the inside of my mask. How'd that happen? Wasn't supposed to get in there. My mask, a cloth mask, as you can see on here, cloth mask does not filter hair. Mine doesn't. Now, some of them probably filter hair out there. Some of you have some really cute, very pretty masks. Some are kind of funny. That's awesome. That's also a slap in the face to those who are sick, because these cloth masks do nothing. They have zero efficiency. All of the cloth masks and materials had near zero efficiency at 0.3. At 0.125, it would be zero. No efficiency whatsoever. And I'm not even going to get into how people are wearing these masks. Oh my goodness. Okay. Anyway, so conclusion. Let's look right here. Conclusion. I'm going to highlight this whole thing. Wearing masks will not reduce SARS-CoV-2. Let me repeat that. Wearing masks will not reduce SARS-CoV-2. Doesn't get much plainer than that. N95 masks protect healthcare workers, but are not recommended for source control transmission. Source control means on the source of the illness. So a sick person, a patient. N95 masks are not recommended for sick people because of the filtering process, like I told you before. Surgical masks, better than cloth masks, obviously, but not very efficient at preventing emissions from infected patients. Now, that is a general statement. Okay, surgical masks do work. They do work for some transmissions. They do work for some viruses, some sicknesses. They work very well. Why do you think we wear them in the healthcare field? Okay, my wife has to wear one all day long. She works in essentially a nursing home. So she's on the front lines. Okay, she wears a mask all day long, but she's also very smart. She's a very smart gal. Those of you who know her, you understand she's a very smart gal. She's also the one in charge of her company's, I guess you could say, quality control when it comes to COVID-19. Okay. So surgical masks are better than cloth, but not very efficient at preventing emissions from infected patients. Why was that? Because surgical masks are not efficient at blocking particles smaller than, was it 200? I think it was smaller than 200. I forgot now. You think I'd have that memorized. 100. Surgical masks are designed to protect patients from surgery risk for droplets. They aren't effective at blocking particles smaller than 100 microns. Cloth masks will be ineffective at preventing SARS-CoV-2 transmission. That's not wishy-washy. Cloth masks will be ineffective at preventing SARS-CoV-2 transmission, whether worn as source control, whether worn if you're sick, or as personal protective equipment. So whether it's worn on the patient or on the public, it is ineffective at preventing SARS-CoV-2. Cloth masks. Folks, I don't know how to get much clearer than that. Let me bounce over here back to that, the CIDRAP, Centers for Infectious Disease Research and Policy. The headline, masks for all for COVID-19, not based on sound data. So those of you who are saying, everybody should wear a mask, everybody needs to wear a mask, protect grandma, not about you, it's not going to protect you, it's going to protect others. Don't be selfish. This masks for all for COVID-19 is not based on sound data. Okay, so please stop that rhetoric. Let me go down to this highlight. I'll post this link too. You can read this whole thing, all about it. I'm not hiding anything from you. I just don't want this recording to take forever. A cloth mask or face covering does very little to prevent the emission or inhalation of small particles. As discussed in an earlier CIDRAP commentary, previously and more recently by Moroska and Milton, 2020, whatever, in an open letter to who? The World Health Organization. In an open letter to the World Health Organization signed by 239 scientists, inhalation of small infectious particles is not only biologically plausible. In other words, yeah, you can breathe it in. Inhalation of small infectious particles while wearing cloth mask or face covering. Yeah, not only is inhalation of small infectious particles plausible, not only biologically plausible, but the epidemiology supports it as an important mode of transmission for SARS-CoV-2, the virus that causes COVID-19. So wearing cloth masks and face coverings is an important mode of transmission of the virus. Why is that? Well, because all these masks and face coverings give people a false sense of security. Even with surgical masks, remember? Surgical masks, great masks, but they don't filter COVID-19. So whether you're wearing a cloth mask, a face covering, those head wraps, whatever, or whether it's a surgical mask, they are ineffective for COVID-19. Can be effective for other things, but for COVID-19, ineffective. It gives people a false sense of security. So if you're wearing a mask and the other person's and everybody's wearing masks, you feel like you can get close to each other because you're protected. You think you're protected. So you can get close to each other. No, that doesn't work, folks. It doesn't work. In summary, though we support mask wearing by the general public, okay, and they're referring to something they said at the beginning of the article, talking about somewhere in there. Oh yeah, do we support cloth mask wearing where mandated? They basically say, yeah, sure. If you want to, if it's going to be mandated and it's a law, then wear it. Follow the law. We're not going to tell you not to wear it in public. So that's what it's saying. In summary, though we support mask wearing by the general public, we continue to conclude that cloth masks and face coverings are likely to have limited impact on lowering COVID-19 transmission because they have minimal ability to prevent the emission of small particles. And as you discovered just a moment ago, virtually, I mean, they're being nice by saying limited impact, but virtually no impact on lowering COVID-19 transmission. Well, some is better than nothing. Well, no, not in this sense, because like I just said, it gives everybody a false sense of security. Best thing you can do is stay away from sick people. Do the social distancing thing. I don't have a problem with that. Do the social distancing thing. But it makes people think they can be close to other people because they're wearing masks. They feel safer. Anyway, where was I? Offer limited, let's see, let me go back. Limited impact on lowering COVID-19 transmission because they have minimal ability to prevent the emission of small particles. offer limited personal protection with respect to small particle inhalation, and should not be recommended as a replacement for physical distancing or reducing time in enclosed spaces with many potentially infectious people. So what's an enclosed space with many potentially infectious people? A nursing home is a very good example of that. Okay? People think they can walk into a nursing home wearing their pretty face mask that, you know, grandma made for them with little hearts and roses and Mickey Mouse on them, whatever. Doesn't work like that, folks. We are very concerned about messaging that suggests cloth masks or face coverings can replace physical distancing. We also worry that the public doesn't understand the limitations of cloth masks and face coverings when we observe how many people wear their mask under their nose or even under their mouth. Or they remove their masks when talking to someone nearby, or fail to practice physical distancing when wearing a mask. I don't know how many times I've seen people wearing their mask under their nose. The only thing that's going to be good for is preventing a bug from flying into your mouth. You could still snort one up your nose, I guess, but not going to get one in your mouth. Some people, I don't know how many I've seen walking around Walmart or wherever with it under their chin, like it's a sling, chin sling or something to keep their jaw from falling off. Or wearing a mask where you could stick your fingers down through the top of it. It's wide open. Folks, you got to get educated about masks. Got to get educated about these masks. I just want to keep repeating this because it doesn't sink in. It doesn't seem to matter how many times I put stuff out there on Facebook. Somebody's going to argue with me. Somebody's going to argue with me about this, even though you've just seen it. You've seen it from reputable sources, from doctors, from surgeons, from lawyers, from experts in epidemiology and infectious disease, respiratory experts in respiratory protection and infectious diseases. They're the experts, backed by science. Remember this one? This letter to the WHO, signed by 239 scientists. Specifically, this was talking about cloth masks and face coverings. I don't know what else to say, folks. I'm not here to badger you. I'm not here to argue with you. I'm trying to help. And I've got even people in the medical field trying to argue with me about this. Folks, get yourself educated. Somebody asked me earlier if I've actually done any research. Can you have anything to back this up? You know anything about masks? Yeah. I've worked in the healthcare field many years. My wife does too. I know what I'm talking about. And again, take me out of the equation. Forget my opinions. Forget my thoughts. Look at the facts. Okay, so I'm done. I'm not going to, there's nothing else to read. I don't know that there's anything else to say. I'm going to do a quick, I just lied. I said there's nothing else to say. There is something else to say. I'm just going to do a quick summary. I'm going to do a quick wrap up, just in case you forgot this in the time that I've read it. COVID-19 particle, 0.125 microns, micrometers, however you want to say it. N95 masks, filter from the outside in, not the inside out. Okay? N95 masks are meant for the healthcare professional, not for sick people. But even an N95 mask will not protect you from getting sick. If I have it, although I'm healthy, I've not been tested. My wife has, and she's tested negative. But even if I tested positive but have no symptoms, I'm asymptomatic, and I'm wearing an N95 mask, this incredible mask, it's not going to help you because it doesn't filter from the inside out. It filters from the outside in. So if I'm infected and I'm wearing an N95 mask, whatever I'm breathing out is going out there. It's not being filtered. The best mask for me to wear if I'm sick is a surgical mask. But it does not filter COVID-19. It doesn't filter the flu. So if you have the flu or COVID-19, wearing a surgical mask isn't going to protect other people, because it only filters down to 100 microns, not 0.100, 100. So it does not filter COVID-19, does not filter the flu. Other than that, a lot of other illnesses, yeah, you should wear the surgical mask to protect other people. This surgical mask will not prevent COVID-19. Cloth masks, these homemade masks that everybody and their grandparent are wearing, and their 6-month-old, my goodness, I've seen everybody with these masks on. Cloth masks do nothing. They do not filter. If a surgical mask will not filter COVID-19, you can bet your bippy a cloth mask will do nothing. So all you're doing is you're making a fashion statement with a cloth mask. It's not protecting you. It's not protecting anybody else. It doesn't filter in or out. Might filter some dirt. Might keep bugs out of your face. It does not filter COVID-19. It does not filter anything. Cloth masks are simply only for fashion. Wear them in a dust storm. If you're going to be out in the desert, wrap it around your face a few times. That'll help keep the dust from getting in your system. But we're talking COVID-19. Does nothing. Okay? So that's it for that. I'm going to stop this recording. I'm going to get this out on Facebook. You all share this. Again, don't come at me. You want to argue with Marilyn M. Singleton, doctor and lawyer. Argue with her. Argue with the Association of American Physicians and Surgeons. Argue with the Center for Infectious Disease and Research and Policy, Infectious Disease Research Policy. Argue with them. Argue with the Dr. Brousseau and Dr. Sietsema, the experts in infectious disease and respiratory protection. Argue with them. Okay? I can't speak for them. I can only tell you what they've said, and now I've done that. What you do with this information is completely up to you. Continue wearing masks, that's fine. Don't bully me to wear a mask, because I'm not going to, unless I'm going to get arrested for wearing one, or I'm going to get fined for wearing one. But I will wear one. And if I'm going to be around sick people, absolutely I'm going to wear a surgical mask. Absolutely. No questions asked. If I'm going to be in a nursing home or in a hospital, if I'm going to be around sick people, I will be wearing a mask, and I will love every minute of it. I don't have a problem with that. I love caring for people. That's why I took the time on my vacation to make this video for you. That's why I've taken so much time out of my vacation to try to talk some sense into some people. So I'm hoping this video works. So anyway, have a great day. God bless you all. Stay safe. Stay healthy.